A 2-year-old premature newborn presents with petechial and persistent subcutaneous bruising. No additional complications during delivery. His vitals are a heart rate of 180 per minute, a respiratory rate of 54 per minute, a temperature of 35.9 degree, 96.6 Fahrenheit, and a blood pressure of 60 30 mmHg. On physical examination, there are dullness to percussion over the bases of the thorax bilaterally. A chest radiograph shows evidence of pulmonary hemorrhage. Laboratory tests are significant for the following: hemoglobin 13.2 gram per dl, hematocrit 41%, leukocyte count 5200, neutrophils 55%, bonds 3%, eosinophils 1%, basophils 0%, lymphocytes 44%, monocytes 2%, platelet count 105,000 per millimeter square to the third. His coagulation tests are as follows. Partial thromboplatin time activated 49 seconds. Prothrombin time 19 seconds. Reticulocyte count 2.5%. Thrombin time less than 2 seconds deviation from control. Which of the following is the most likely cause of this patient's condition? The correct answer is A. Disseminated intravascular coagulation, DIC, is an acquired syndrome due to activation of the coagulation system that can be induced by many causes, such as sepsis, trauma, and malignancy. Clinical manifestations vary depending on the ability of the homeostatic system to compensate for the ongoing depletion of coagulation factors and platelets. The diagnosis of DIC is based upon clinical findings of hemorrhage and microthrombi in patients with predisposing underlying conditions and abnormal coagulation tests. No single test can be used to confirm the diagnosis. Laboratory values must be evaluated in aggregate, and serial testing is more informative than single measurements when evaluating neonates, it is important to recognize that neonatal values of laboratory tests used to establish the diagnosis of DIC differ considerably from adult values. The laboratory evaluation usually differentiates DIC from other causes of bleeding in children. A major principle in the management of DIC in pediatric patients is treatment of the underlying primary disease. In patients with clinically significant bleeding, we recommend the administration of replacement therapy with platelets and coagulation factors. This case shows a premature child with a clotting disorder and multiple bleeding manifestations. The DIC secondary to neonatal sepsis is more frequent in preterm children and is associated with clotting disorders, possible thrombocytopenia, and a typical picture of sepsis, fever, hypotension, tachycardia. Option B, autoimmune thrombocytopenia, is mediated by maternal antibodies that react with both maternal and fetal platelets. This occurs in maternal autoimmune disorders, including immune thrombocytopenia, purpura, and systemic lupus erythematosus. The diagnosis is usually apparent from the mother's medical history and maternal thrombocytopenia. However, the platelet count of affected mothers may be abnormal after a splenectomy or if there is sufficient compensatory thrombopoiesis. This choice is easily ruled out in this patient due to the normal platelet count. Option C, fetal and neonatal alloimmune thrombocytopenia FNAIT is due to the distraction of platelets by opsonization by maternal antibodies. Severe bleeding is the major risk, especially intracranial hemorrhage. The normal platelet count in this patient makes this diagnosis unlikely. Option D. Vitamin K deficiency is common in newborns, and if not replaced, the infant is at risk for vitamin K deficiency bleeding, VKDB. In this diagnosis, different types of bleeding are observed, but it is most prominent in the gastrointestinal, nasal, umbilical, and central nervous system, all of which are not observed in the patient. For prevention, administration of parenteral vitamin K at birth and supplementation of infant formulas with vitamin K are recommended. Option E. Platelet dysfunction will cause a bleeding disorder even with a normal platelet count and normal coagulation tests. However, this is caused by rare congenital conditions or by acquired ones, liver disease, drug effects, uremia, and etc. There is no evidence in this patient for any of these conditions. Learning objective: disseminated intravascular coagulation. DIC is an acquired syndrome due to activation of the coagulation system by a variety of underlying disorders, for example, sepsis, trauma, and malignancies. Clinical manifestations vary depending on the ability of the hemostatic system to compensate for the ongoing depletion of coagulation factors and platelets. The diagnosis of DIC is based upon clinical findings of hemorrhage and microthrombi in patients with predisposing underlying conditions and abnormal coagulation tests.